Thanks, Chair. Good morning, Chairman and members. Thank you for inviting us to update you in relation to vaginal mesh implants and the services we have in place to support people affected by complications in their use. The Chair has already mentioned that I'm joined by Dr. Cleena Murphy, Ms. Catherine Donoghue and Dr. Suzanne O'Sullivan. Mesh is a medical product used in a range of surgical specialties, but our focus today relates to mesh used in two urogynecological procedures in women: the treatment of stress urinary incontinence and pelvic organ prolapse. In November 2017, following the experiences of many women with mesh implants that were causing pain, infection or other complications, the then Minister for Health, Mr. Simon Harris TD, requested the Chief Medical Officer to review the clinical issues involved. In July 2018, the HSE paused the use of vaginal mesh implants for the treatment of SUI and POP. The CMO's report, The Use of Urogynecological Mesh in Surgical Procedures, was published in November 18. It gave a comprehensive history of vaginal mesh implants, their purpose and the problems experienced by some women that led to the pause in their use. The report had 19 recommendations covering two broad areas: responding to the needs of women experiencing vaginal mesh implant complications and considering how clinical practice in using vaginal mesh might operate should the pause be lifted. To date, 11 recommendations are completed, 5 are ongoing and 3 are no longer deemed clinically appropriate to progress. The 5 ongoing recommendations are prospective clinical recommendations and will be implemented if vaginal mesh implants are used again in the future. I'd like to outline the work done to meet the needs of the women and people affected by problems with mesh implants. In order to initially identify and assist those patients who needed support, assessment or had questions about their care or experience, a dedicated page on the HSE website was created with detailed patient information and guidance. The information was promoted in news media reports on social media and ensuring the page was easy to access on search engines. Each hospital group identified specific contact details for their patients, and these were provided on the HSE site. Communications from approximately 70 women were received, and all of the women who made contact were offered appointments either at the time or subsequently. A new national mesh complication service has been established, with a centre in Cork and one in Dublin, and with the option to refer people for specialist care abroad where that is needed. The HSE put in place a 3-tiered response to mesh complications to ensure that women always had a pathway of care. Firstly, a woman experiencing post-mesh complications is advised to contact either their GP or the consultant who inserted the implant for a clinical assessment. Next, if specialist care is needed, they can then be referred to the National Mesh Complication Service. This service is delivered across 2 centres and provides expert specialist care to women during requiring mesh removal. The Mesh Complication Service has a multidisciplinary team in place with a range of medical specialties involved. The 2 hospitals providing this complication services are recognised urogynecology centres with subspecialist expertise. These centres have extensive experience in dealing with complex pelvic floor problems, including mesh complications. An additional HSE investment of $1.3 million was provided specifically for this service in 2021. The consultants involved in the care of mesh complications have specialist and subspecialist training, which is earned mostly abroad in the UK, US and Australia. In addition to this, an internationally renowned subspecialist training programme in urogynecology has been established in Ireland. The National Mesh Complication Service, which is a HSE public service, does not make a distinction between women who had their vaginal mesh implanted in a private or public facility. Information on how to access the National Mesh Complication Service is published on the HSE dedicated webpage and is available from all acute hospitals, GPs and patient representative groups. Both centres have full diagnostics available, including translabial scanning. In November 2021, a consultant urogynecologist from the UK led a translabial and transvaginal teaching day and clinic in urogynecology department in Cork. Feedback obtained from the women who attended the clinic was positive. There is an identified lead consultant within each centre for this service. To date, the centre in Cork has seen approximately 40 patients and currently has no waiting list. It has a designated mesh clinic which runs every 6 weeks. The centre in Dublin has seen approximately 69 patients and it has a waiting list of 16. We anticipate that all patients will have been seen by October 2022. The third tier of the pathway is the availability of treatment abroad. For some patients who have defined clinical complexities, access to treatment abroad gives an additional pathway when the level of complexity requires. An application for treatment abroad can be supported by the HSE National Mesh Complications Service. The care of the patient reverts to the referring consultant upon return to Ireland, and all follow-up care is organised through them. I would like to close by acknowledging once again the difficult experience of the significant number of women who have and are suffering serious complications from the use of vaginal mesh implants. The HSE hopes that the significant investment made in developing the dedicated services to support women will have a positive impact and outcome for people affected. We would like to take the opportunity to encourage anyone who may be suffering with mesh complications to contact their GP or the HSE for care and support. This concludes my opening statement.
Thanks very much.